Well, after much anticipation, President Trump announces his America First healthcare plan. To help us break down the plan, we want to welcome Medicare and Medicaid Services Administrator Seema Verma to the program. Hi, Administrator Verma. Thanks so much for being with us today.
Great to be here. Thanks for having me.
So first off, I want to get into some of the details of the plan. One item being that there are 33 million Medicare beneficiaries that will each be receiving $200 in prepaid cards for prescription medicine. Can you elaborate a little bit more on where that money is going to be coming from, and is this a one-time payment?
Sure. Well, the president has always been committed to lowering costs for America's seniors, and he's had a strong record of doing so. One of the things that he talked about at the event is that we've delivered lower costs for premiums. So our Medicare Advantage premiums have gone down on average since he started by 34%. That is a historic low, a 14-year low. And we're seeing the same thing in the Part D program, where Medicare beneficiaries get their prescription drug coverage, and the numbers there are terrific. They've gone down to 12%, so a reduction of 12%. And then on top of it, we're going to be offering for the first time new plans, over 1,000 of them, that are going to be providing insulin at $35 a month. And so the cards that the president talked about are just another effort to lower costs for seniors. We're going to be passing out these cards, and this is going to help them lower their out-of-pocket expenses.
And is that coming from the CARES Act that Congress passed, or is it coming from some other part of the money that's already been appropriated by Congress?
Well, this comes from the Medicare program, and it's intended to try to understand whether lowering out-of-pocket expenses for seniors will have an impact on their health. You know, we're hearing from seniors across the country that many of them have trouble affording their prescriptions. And when they have trouble paying for them, many of them don't take their medications. They split them in half. They're not taking the right quantity of the medication. And so the thought here is that if we help them lower their out-of-pocket expenses, does that actually have an impact on their health? Does that lower hospital utilization? Do we see better health outcomes for our seniors?
And I want to move on to a key election topic, pre-existing conditions, which is something the president's been talking about. The pre-existing conditions are currently covered under Obamacare, as we know. The president noting a lawsuit against the Affordable Care Act at the healthcare event that he held yesterday in North Carolina. Now, he did say that pre-existing conditions would be covered if the Supreme Court overturns Obama's law when they take it up after the election, of course. Can you elaborate a little bit more on how people would still be covered under the president's plan?
Well, the president was very clear that he is going to protect individuals with pre-existing conditions. And it's important to remember that those protections don't occur today under Obamacare. Protections for pre-existing conditions have been in our country for many, many years, predating Obamacare, in the employer-sponsored health insurance market. But for individual market, that's what Obamacare tried to do. But unfortunately, the premiums just skyrocketed, 100%, 200%. Now, the president has stabilized the market, brought more choices, but the reality is for people that don't get subsidized, if they have a pre-existing condition, a lot of times their health care coverage is so expensive that they don't have those protections. And that's what the president is fighting for: lower costs, better care, and more choices.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.